Sir, we can start now. We are YouTube live.
Great. So you have started the recording, right? Vipul, you have started the recording. I don't have to do anything
Yes.
from my end.
Yes, sir. Yes, sir. Yes.
Okay. I will now share my screen with your permission, Bipin bhai.
Yes, Ash, please go ahead.
Okay. So we talked about the
So,
first part of, pardon?
Sir, Vipul, you are full screen, sir, for the presentation.
Yes, yes. We talked about the importance of kidneys in the first part, and I will briefly review what I spoke in my last presentation. And I told you that all of us have two kidneys which are located in the back part of our body, the abdomen, and then each kidney has 10 lakh filters like this, which filter out the blood and remove excess water and the waste products and maintain the concentration of salts in the blood at a constant or within a narrow range. And I also mentioned that besides removing the waste products and maintaining a constant volume and composition, kidneys play an important role in controlling blood pressure, and they help in formation of the red blood cells, and they activate vitamin D and make our bones strong. Then I mentioned about how our kidneys can be damaged, and there are two ways in which they can be damaged. One is an acute kidney injury, where we can, if we can treat the underlying cause, there can be a complete recovery. And when we cannot treat it, then it will slowly and steadily progress, and we call it chronic kidney disease. And this is the one which is worrisome because this is a permanent problem. And then we discussed about what are the different causes of chronic kidney disease, and that in majority of the cases, we can prevent this chronic kidney disease. So this is where we ended last time. And now, today what I want to tell you is about what are the symptoms and signs, so that if you know about this, you will get yourself checked early. Many times people do not go for a checkup because they don't realize the importance of getting checked when they have certain symptoms. Then I'll talk about how the diagnosis is confirmed, and finally I will talk about the treatment. So one of the most important symptom and sign of chronic kidney disease is high blood pressure. And even last time I stressed on this part that anyone with high blood pressure must get their kidneys checked. Many times those with high blood pressure go to a heart doctor and get a cardiogram done, not realizing that high blood pressure is actually a problem of the kidneys, and they need to go to a kidney doctor. And everyone with high blood pressure must check their kidney function to find out whether kidneys are the cause of high blood pressure. So this is one very important message that everyone must take home from today's talk. Swelling of the legs. Now, quite often I find people telling me that I have been getting swelling of legs, but I get that swelling when I have traveled for a long time, either in the bus or in the car or in the plane. You know, I had a long flight from Mumbai to London, and then when I got down, I got swelling. But you were traveling long distance even before. Earlier, you did not get swelling. Why should you get swelling? So if you get a swelling like this, where when you press, it creates a dent, it is not normal. And an important cause of this swelling can happen in other conditions also, like if you have a heart problem, if you have a liver problem, but more commonly, you see it with kidney problem. So if you have swelling, do not ignore, please get yourself checked. Many times when you get frequent headache, backache and pain, one keeps popping in painkiller medicines. They'll take Anasin, they'll take Ceridon, they'll take Combiflam. This is not a good idea. There's also a medicine called as NICE. Taking NICE is not nice. If you get frequent headache and backache, it may be an indication of underlying kidney disease. Kidney disease causing high blood pressure, which leads to headache. Kidney disease making your bones weak, which gives you backache. So if you have a pain which is going on for a long time, don't just keep on taking painkiller medicines. Find out, why am I getting pain repeatedly? Others are not getting pain. Why am I getting pain? You will not do this if you get fever. If you get fever, you run to the doctor. So pain is also a symptom which should not be taken lightly, and one must get checked why one is getting pain. If you get increasing weakness, it is often an indication that the level of hemoglobin in your blood is low. And there is no reason why your hemoglobin should be low if you are eating well. So while it can be because of deficiency of iron and some vitamins, for someone who is eating well, that should not be the cause. And at the most, after taking iron, if your hemoglobin does not improve, get your kidney function checked. We all know that it is extremely difficult to lose weight. So if someone were to be weighing 80 kg, 90 kg, and now his weight is coming down to 85 kg and 80 kg, he thinks that he has been able to achieve weight loss. But let me tell you, there are various clinics which run and charge anywhere from 5,000 to 10,000 rupees to 20,000 rupees to make you lose 1 kg weight. So you can imagine how difficult it is to lose weight. So if without an effort, I can understand if there is a sincere effort, making a lot of changes in your diet and exercising very heavily, intentionally working hard is one thing. But without making very hard efforts, if you are losing weight, there is some severe problem in your body. Do not ignore. If you have lost significant weight, like 5 kg in 3 months, it's a significant weight loss. You should think about some severe underlying disease. Kidney disease could be one of those, and you should get yourself checked. And then if your appetite is poor, if you have nausea and vomiting, of course, one would get oneself checked. These symptoms usually come at an advanced stage of kidney disease, and by then one would check. But these are the symptoms which I find are often present in many of the cases that I see, which were present for a long time, were present for years, but they were ignored. And that is the reason when they come to us, they come at an advanced stage of kidney disease. So having seen the symptoms and signs of kidney disease, how do we make a diagnosis? Because symptoms can be. How do we put these symptoms together and make a diagnosis of chronic kidney disease? So if there are symptoms and signs that I mentioned about, if I do a checkup of urine, and this is one simple test with very minimal cost, is often missed. Today I find people come to me with a battery of tests done, a whole battery of investigations done in the blood. They have done a CT scan, they have done an MRI, they have done an angiography, but this simple test has not been done. This simple test gives us a wealth of information. So if I find that there is protein in the urine, or if there are red blood cells or white blood cells in the urine, it is not normal. There is a problem in the kidney, and that is why I'm finding this. So anyone with an abnormal urine must get themselves checked further to evaluate the kidney function. Today, one good thing is that when you go for a new job, you need to go through a health check. And these tests are done as a part of taking you up for as an employee. So it is possible for one to identify or diagnose at an early stage, but sometimes these test reports are ignored, and that should not happen. If a blood test has been done and it shows if the normal creatinine is 0.8 to 1.2, depending on whether a person is female, male, muscular, not muscular. If the normal value is, let us say, 1, and if your creatinine is 1.5, it is not normal. In fact, one thinks that there is a little rise in creatinine, but actually when creatinine has gone up from 1 to 1.5, there's a 50% drop in kidney function. And this is something which many people don't realize. Even when it goes from 1.5 to 3, they say, well, it's a little rise. But when it is at 3, your kidney function is down to 30%. Now, when this creatinine goes from 3 to 6, that is the time then they get, no, my kidney function was okay. I had a very little rise in creatinine. But they didn't realize that there was a substantial reduction in their kidney function. When it goes from 3 to 6, the drop in kidney function is only 15%. So there are big jumps in creatinine at later stages. And one needs to identify a problem at an early stage when there is a little jump in creatinine. So if I find that someone has persistently elevated, for example, if in 2018, the creatinine was 3 milligrams per deciliter, in 19 it became 4, in 20 it became 5, and now it is 6, I know that this is chronic kidney disease. Many times people have not known about this, and they say, no, let us do the test and see. But clearly your reports are showing for last 4 years that there has been a persistent loss of your kidney function, and it is further reducing. And the most important test which will tell us for sure is shrinkage in size of the kidneys. I would like everyone to appreciate this part, because once you have a shrinkage in size of kidneys on ultrasound, then it is a definite diagnosis of chronic kidney disease. And when we say that it is chronic kidney disease, it means it is a permanent injury which cannot reverse. Now, this is where many people get fooled. Now, let me show you about the ultrasound. Now, normally, the kidney size is about 10 to 11 centimeters and 5 to 6 centimeters. And if you see, it appears like a nice black ring. When you have a chronic kidney disease, the kidneys will shrink to 8, 7, 6 centimeters, and you don't see it as a nice black ring. We call this as increase in echogenicity of the kidney. So if I find that someone has been having a progressive rise in creatinine and kidneys are small, there is no doubt at all that this is an advanced chronic kidney disease. At this stage, if someone tells you that by this alternative treatment, your kidneys will recover, it is a big mistake. That is not utilizing the education that we have had all these years. The purpose of education is to apply the rationality. The knowledge that you have learned, that you have gained, has to be applied in practical terms. So if you do not use the knowledge that you have got from your education, it is a big mistake to get carried away by someone giving you the false hope that these kidneys can recover that function. And this is one important point I want to make. Please do not get carried away. If your doctor has told you that you have a chronic kidney disease which has been progressing, your kidneys are small, if you have doubt, go to another kidney doctor. He will tell you the same thing. If two doctors have told you the same thing, and if someone tells you, no, this kidney will reverse, then you are being taken for a ride. Please don't get carried away by false hopes given by anyone. So having made a diagnosis of chronic kidney disease, how do we treat? Now it is very simple to understand that for any disease to be treated, you must first identify what the cause is. So even if you have a chronic kidney disease, if you identify what the cause is, and if you can treat the cause, you can stabilize, and that kidney can last you all your life. It doesn't mean that it has to come back to normal. God has given us a lot of reserve. So with less of kidney function, we can still carry on normally with all our life. So try and identify the cause. So when do we try and identify the cause? If all our urine and blood investigations do not lead us to the diagnosis, we often tell our patients that we do a kidney biopsy, which means putting in a small needle inside your kidney and taking a small piece of kidney tissue and then see under the microscope. If I can identify a treatable cause, I'll be able to stabilize. I'll give you an example. Way back in 1994, I saw a man in his 50s who had high blood pressure and steadily increasing creatinine. So when he came to me, I did a sonography for him. The sonography showed normal sized kidneys. So despite normal sized kidneys, why is your kidney function not normal? I told him that we should do a kidney biopsy, make a diagnosis. When he came to me, his creatinine was about 2. But when it came to doing a biopsy, he disappeared. He came back to me after 3 or 4 months, and now his creatinine was 4. I told him that, look, if I don't find out the cause, I don't know how to treat you. If I don't treat you, you see what has happened. Your kidney function has further gone down. But he still did not like the idea. He went away and came back a month later, and now his creatinine was 6. I told him, now if you don't want to do biopsy, you should prepare for dialysis. And that is where he realized that he must undergo a biopsy to make a diagnosis. So we did a biopsy and we found that there was TB infection in the kidney. And today TB is almost completely treatable unless you have a multi-drug resistant or extra drug resistant TB. So we found out the cause. We treated him for TB from 1994 till 2021. He continued with stable kidney function. He died this year from COVID infection, unrelated to his kidney problem, at the age of 84 years or 87 years. So you can see that if we can identify the cause and if that cause is treatable, then you can stabilize your kidney. Now, I told you that high blood pressure can result from kidney disease, and this high blood pressure can further damage kidney disease. So there is a vicious cycle. So if the blood pressure is high and if I control it, then the rate at which kidney function is going down, if this is the slope of kidney function going down, I can make it a flatter slope. So control of blood pressure is the next most important thing in treatment of chronic kidney disease. Diet modification cannot cure your problem. If there is a disease process, then by changing your diet, you may be able to again slow down the rate at which kidney function is going down. So if the rate at which it is going down is like this, you may be able to make it a little slow, but it will not cure your kidney problem. And how does diet modification help? I will explain in the next slide. Then, when your kidney function is down, there are chemical abnormalities in the blood. They also set up a vicious cycle and cause further damage to the kidneys. I told you that one of the important functions of the kidney is to produce a hormone which helps in formation of red blood cells. We become weak, but today we have this hormone available to us like insulin. If we give this hormone, we can treat anemia and their weakness. Similarly, we now have available active vitamin D and we can prevent the bones from becoming weak. One extremely important part of treatment of chronic kidney disease is to avoid acute insults. If I cannot treat, let us say there is a chronic kidney disease, I do not know what the cause is, I take care of all this, and I slow down the rate at which kidney function is going down. Sometimes the kidney function will remain stable, but I may not be able to reverse. But that does not mean that I must take treatment. I have a problem, I must take treatment. That is something which you must take out of your mind. There are several acute insults which can further damage kidney. One is painkiller medicines. Typically, someone who is overweight or obese, diabetes itself can cause kidney problem. Because of overweight, your knee joints pain, you get arthritis, and you take painkiller, you add the insult and cause further kidney damage. If you don't take painkiller medicines, your kidney function can go on longer for many, many more years than if you take painkiller medicine. And alternative therapy. I just told you that we may not be able to treat, but that doesn't mean that you have to take some treatment. Don't get carried away by someone promising you, by taking this treatment, you will get better. White powder given to you, you don't know what it is. It will add fuel to fire. A kidney which can last you for 10, 15, 20 years will go away in 6 months or 1 year. Please do not take any therapy that you don't understand. And the most important fact is that God has given us such a wonderful body that most of our problems get better by themselves. Do not keep on taking medicines. Today, we have seen many people who out of fear of getting COVID have taken alternative therapy, thinking that it will boost their immunity. And they have come with kidney and liver problems. They get COVID infection and they take 8 to 10 medicines when we know that no medicine works. It is your own body which will take care of it, but they take multiple medicines. This is one important message. God has given us a wonderful body. Do not take any additional unnecessary medicine. You have diabetes, treat diabetes. You have high blood pressure, treat your high blood pressure. And that's it. Let me now come to the role of diet modification. I will come to that. So what is the natural course? As I said, the natural course is that it is usually progressive due to persistence of underlying cause, high blood pressure, adaptive changes. This is what I will explain to you. I told you about treatment of chemical balance, prevention of acute insults. Now, usually, when you do not know the cause of chronic kidney disease, you cannot treat it. It will progress, but not always, as I said. But if it is a progressive kidney disease, it will culminate in end-stage kidney disease. Now, let me talk to you about this adaptive changes. Supposing if in your office there are 25 people who are working and 12 people fall sick and they are not able to come to office, the whole burden now falls on remaining 13 people. They will work hard to complete the work. But in the long run, if that same thing continues, out of 13, another 2 people will fall sick, 11 people will work even more, then some of them will fall sick. And slowly and steadily, that overburden itself will contribute to further reduction in the manpower. So in the kidney, there are 10 lakh functioning units like this. This is where the blood comes to the kidney for filtration. And after the waste products are removed, the blood returns back. This is called as the vessel which brings blood to the kidney, and this is a vessel which takes purified blood back to the kidney. So when the number of functioning units in the kidney reduce, what will happen? Each functioning unit will work more. How will it work more? As an adaptive change, there will be an increase in blood supply to each functioning unit. This part of the blood vessel which carries back the blood will constrict. This will increase in size. This will narrow in size. So the filtration done by each filtering unit increases. They are working more. But this increase in workload proves to be detrimental in the long run. And this increase in workload can be reduced by reducing the proteins in the diet. Because you know that main function of the kidney is to remove the waste products which are resulting from the proteins that you eat, and the protein breakdown results in waste products which are removed by the kidney. So if I reduce the workload, then these adaptive changes will not occur and this kidney function will be maintained for a longer time. So if out of 25 people in the office, 12 people have gone away, 13 people are there, now I reduce the workload, so certain people will continue to function well for a long time. That is what the adaptive changes mean, and that is the rationale of our advising a low protein diet to many people with kidney disease. I already mentioned to you about prevention of acute insults. So do not be over aggressive and bring down the blood pressure too much. Whenever someone has a chronic kidney disease and their kidney function suddenly worsens, think of something like an obstruction to the kidney or an infection in the kidney or some drug used which may be responsible for the cause. So this is another interesting example. This was a lady in her 50s with a hereditary kidney disease. I mentioned to you polycystic kidney disease. So she was referred to us from Jaipur because her kidney function was very low and she was advised to make a small surgery called as fistula for dialysis. So I went through all her papers. She had come to us in 2013, sometime in February 2013. And I went through her papers. In November 2012, her creatinine was 2. And when she came to us, her creatinine was 12. This is not so rapid that a kidney function will deteriorate in polycystic kidney disease. So we did further studies on her. And we found that on both the sides, she had kidney stones which were blocking the flow of urine. We removed these kidney stones. She came back to a creatinine of 2 or 2.5. And even today, she is not requiring dialysis. 9 years, 8 years down the line, she still does not require dialysis. So before one makes a diagnosis of chronic kidney disease, we make very sure that there is no reversible factor. When you have a kidney disease, it can be due to an acute component and it can be due to chronic component. The chronic component will not reverse, but the acute component can reverse. So this is what can be done if you try to look for any possible acute cause of decline in kidney function. Now, I told you that when you have a chronic kidney disease for which you cannot treat the cause, you can understand that slowly and steadily the kidney function will go down. For example, if you have diabetes, you don't take good care of your diabetes. Diabetes has affected your kidney. Until this stage happens, if you control diabetes well, your kidney will be protected. But if diabetes has been left poorly controlled, and after 10, 15 years, now your kidney has been damaged. Even if you control diabetes, you cannot eliminate diabetes. There will be phases when your sugars will be high, your sugars will be low. So diabetic kidney disease just cannot be reversed because we are not able to eliminate diabetes and it will continue to progress. In the same way, any kidney disease for which the cause cannot be identified or cause cannot be treated will slowly and steadily progress, and a stage will come when practically entire kidney function is lost. When practically entire kidney function is lost, in simple layman terms, kidneys are dead. So when your ultrasound shows that your kidneys are 5 or 6 centimeters in size as against 10 or 11 centimeters, for all practical terms, your kidneys are dead. And this is where if someone gives you a false hope, please do not get carried away. It would mean that you have not made proper utilization of your education. It would mean that you are completely irrelevant in approach to your healthcare. Now, once the kidneys or once anything is dead, it cannot be revived. We have to accept it. It is difficult, but one has to accept that once the kidneys are dead, you need a replacement. If someone leaves your office, you need a locum for your work to go on. So you need a replacement. Now, 60 years back, there was nothing like this. With progress in medical science, today we have a lot of options for treatment. So today you have a renal replacement therapy, either in the form of dialysis or in the form of kidney transplant. Both these options are available. And there are people who do well for years on dialysis and on kidney transplant. Now, there are two types of dialysis. One is hemodialysis, where one goes to a dialysis center, gets connected to this machine. I told you that for this type of dialysis, we make a small surgery on the hand called fistula, so that we can take out the blood, make it run through the artificial kidney. The waste products are removed and the purified blood is returned back to the body. Typically, one does 4 sessions, one does dialysis 3 times in a week with each dialysis of 4 hours duration. The other alternative is putting a catheter inside your abdomen. Your abdomen has intestines, but there's a huge cavity, and this is called as peritoneal cavity. So what one does is that one puts 2 liters of solution inside the peritoneal cavity. This solution has no waste products. This membrane will allow the waste products which are present in the blood to come out into this dialysis solution. After 6 hours, the solution containing waste products is removed and another 2 liters of solution are put inside the body. One does about 3 such exchanges in a day. Dialysis will do only about 10 to 15% of the waste removal function of the kidney. It will not be able to do the function of making blood for your body, of making active vitamin D and making your bones strong. Your blood pressures will still remain high. So it is a partial treatment. Better option is kidney transplant. In kidney transplant, you can have a living donor. As I say, God has given us a lot of reserve. We all have been given 2 kidneys. And one of the 2 kidneys can be donated. Observation over the years have shown that 1 kidney is enough for normal survival. There are people who are born with a single functioning kidney, or they are born with only 1 kidney, and they have lived all their life normally. And maybe after the age of 80 years, when they have died of unrelated cause and post-mortem done, it has been realized that he or she had only 1 functioning kidney. And then we have experience from last 60 years of transplant that after donation of 1 kidney, the donor has remained perfectly well with single kidney all the life. So a living person can donate a kidney, but it is not always possible to get a living donor. The other thing is what is called as cadaver donor. A cadaver donor is a person who is dead. Now, it doesn't really make sense. Just think, does it make sense that after we are gone, we burn or bury our organs? The organs which can give life to people, gift which is the biggest gift of life, giving life. Can anything give life to a person? No. No matter how much money you have a person with heart failure, no matter how much money you have, you cannot save his life. The only hope of survival for a person with end-stage heart failure is a heart transplant. For a person with lung failure is a lung transplant. Fortunately for kidney, a living person can give, but there are not enough living donors. So it doesn't really make sense for a person to bury or burn the organs which can give them a completely normal lifestyle. So normally 1 kidney is removed. In case of a cadaver donor, 2 kidneys are removed and given to 2 people. The new kidney is implanted in the front, in the lower part of the abdomen. Nothing is done to the old kidneys. Old kidneys remain where they are. They are silently sitting there. They are not causing any problem in your body. If they are causing problem, for example, if those kidneys are infected, if they are giving very high blood pressure, then we will remove them. But if they are not giving problem and silently sitting inside, it makes no sense to subject someone to surgery just to remove those kidneys. So let those kidneys remain, put a new kidney right in front, connect the blood vessels, connect the ureter to the bladder, and we can see the kidney functioning right from the anastomosis being made. We can see the urine coming from ureter as soon as the blood connection has been established. But let me tell you, the dialysis and transplant are not easy. They are extremely expensive. Most common people cannot afford this. In the long run, over a period of time on dialysis, because it's a partial treatment, you keep on becoming weak. You cannot enjoy a normal quality of life. If you are on hemodialysis, you go 3 times a week, you can't travel much. There are a lot of restrictions in life. So very expensive, quality of life is not good, and your survival is significantly curtailed. A person who is healthy at the age of 40 will live for another 40 years, going by today's average lifespan. A person who is on dialysis, of course, it will depend on what is the cause of kidney disease, what is the age, but the average lifespan is about 10 years. You see a significant loss in the number of years that one can live. With transplant, again, cost is an important factor. More important is where to get the donor from, where to get the transplant from. You return to a good quality of life. But here also, you need a regular follow-up. You need to take medicines lifelong. And because you take medicines which suppress your immunity, you can be at a risk of infection. Unless you are lucky that you have someone who is from the family, who is fully matched, and you get kidney from such a person, you don't need to take too many medicines. You are one of the luckiest persons. So we have to work hard to not reach the stage of end-stage kidney disease. And that is the purpose of my bringing out to you the importance of the kidneys. The kidneys are the brain of our body. They perform number of functions and not just removal of waste products, but they maintain a constant volume and composition of our body. They make blood for us. They make bones for us strong. They keep our blood pressure in control. We cannot afford to take our kidneys lightly. So I have some important take-home message for all of you. And please remember this. These are absolute pearls, more important than pearls, diamonds, gold, silver. Do not take diabetes lightly. Please control your blood sugars well. And this can only be achieved by close monitoring. You cannot be doing your checkup once in 2 months, 3 months. You need to closely monitor your blood sugars, have to remain within a normal range for all the 24 hours a day. Then only you can prevent the complications. If your blood pressure is high, please check your kidney function. Don't just take blood pressure medicine for a few days. Your blood pressure is normal and stop your medicines. Try and find out what is the cause of high blood pressure. And it could be kidney. Keep your blood pressure in good check and your kidney function will remain stable for long. If you get a kidney stone, it is not enough to get your stone removed. Do regular monitoring. Find out why you formed the stone. Do regular monitoring, like keep doing your ultrasound of kidneys every 6 months to check if new stones are forming. If you have a tendency to form stones, you will keep forming new stones. And sometimes if you don't have symptoms, they will silently keep on damaging the kidney, which can completely be prevented. Do not abuse painkiller medicines. If you have pain, try to find out what is the cause. Taking for 3 days, 5 days is okay. But don't keep on taking it again and again. Why am I getting pain is what you should need to find out. Do not take any therapy about which you do not know. If I write to you a medicine today, you put it in Google, you go to any corner of the world, one will be able to tell you what this medicine is, what its effects are, what its side effects are. With an alternative therapy, it's just a white powder. You don't know what it is. A kidney which can last you for years will go down very rapidly. Do not take unnecessarily medicines. If you have diabetes, just take medicines for diabetes. Don't think that this will boost your immunity. This will reduce the oxygen stress on your kidney. These vitamins will make you strong. That is all useless. When you eat a well-balanced diet, you get everything. You have diabetes, control your diet, exercise, that doesn't control, take some simple medication, monitor your blood sugar. That's it. Do not unnecessarily take medicines. William Osler, father of medicine, says one of the first duties of the physician is to educate the masses not to take medicines. And I wish this message were to be there in the beginning of COVID pandemic, and one would not have taken so many medicines just when they get diagnosed with COVID or to prevent COVID. Please do not take medicines. And this is one important education that I want to give today. And finally, I would like to gift you with this wonderful frame. all of us put nice frames in our drawing rooms, in our bedrooms, and I have this wonderful gift from Narmada Kidney Foundation for all of you with all the take-home messages. You can keep it so that it reminds you, your family members, the friends who visit you, the relatives who visit you about how to take care of their health. And the message here is not just for kidney disease. This message will overall help you to maintain good health. So that brings me to the end of second part of my talk on importance of kidneys. Like last time, I would like to entertain questions, and there should be questions. If there are no questions, that means everyone has not understood it properly. So there have to be questions. And only if there are questions that we will think. Let us not just follow what is in the books. It is good to learn from the books, but then we have to ask questions and we have to think ourselves. And we have to come out with some new ideas which will help the society. So thank you, ladies and gentlemen. I hope you like the frame, and I hope many people will make a frame and keep it in their drawing room. Thank you.
Sir, can you explain more about active vitamin D and how to take it?
Yes, so, we get vitamin D by two sources. One is when you are exposed to sunlight, and that is why it is good for a morning walk, nice sunlight, and you will get your regular dose of vitamin D. The other is from the food that you eat. So there are two sources of vitamin D, and if this is not providing you with adequate vitamin D, you also get vitamin D tablets, but one doesn't need to take them. Now, vitamin D that enters your body doesn't work directly. It has to be first activated by liver, and then it has to be activated by the kidney. So no matter how much vitamin D you take, if your liver is weak or if your kidney is weak, that vitamin D will not do the function of introducing adequate calcium in your bone. Your bones will not get mineralized and your bones will become weak. Fortunately, we understand the formula of this active vitamin D, and it is now available in tablet form. So that is active vitamin D.
Hi, sir. Good morning. I'm calling from Dubai.
Yes, Vijay.
Yeah, I'm calling from Dubai, Shashi Bhatia.
Yeah, Mr. Sashi.
Yeah, I had my transplant 10 years before in Bombay, in
Yes.
Bombay Hospital.
Yes.
And I recently took the Pfizer vaccine, my first dose, and second dose is after 21 days. And my kidney function is normal, but my HbA1c is 7.6. And I'm taking a couple of medicines of sugar and my kidney function, my kidney medicines and my BP medicines and my vitamin medicines. So it is a safe for the kidney transplant patient to take Pfizer. I already took my first dose, and what...
So, Mr. Sashi Bhatia, this is not a kidney OPD. This is an educational presentation.
Okay.
Your question is completely irrelevant to the presentation, which is about importance of kidneys.
Okay.
So this is a question that you should discuss with your doctor.
Okay.
In this meeting, the purpose is not to answer the questions pertaining to kidney of each person attending this meeting.
Okay.
The most important purpose of this is to educate you about how to take care of your kidneys.
Okay. When you have the next session, doctor, for the transplant patient?
So, Mr. Bipin Mayekar is in charge of planning these programs. And how did you get this information?
We got the mail and we got...
So you will get the mail when it is pertaining to transplant. Mr. Mayekar?
Yeah.
Sir, we have clearly mentioned that this is for the introduction of importance of kidney, and it will be an introductory session.
Okay, okay. Yeah.
I'm sorry for the inconvenience if there is any distortion.
No, there is no inconvenience, but I'm just trying to explain to everyone that
Yes, sir.
the purpose of this is to educate about how to take care of kidneys and understand the importance. Otherwise, everyone will have number of problems or questions.
Okay,
Very
sir. Can I
This
ask
is not an
how?
OPD. This
Yeah.
is an educational purpose.
Okay, sir. I got it. Okay, sir.
Sir,
How
can
I
you,
can? Yeah. Sir.
sir, can you give online consultation to this gentleman?
Yes, sure.
Okay.
Okay, no problem. Yeah, you can. I'll just share my number, and you can. I can have a word with doctor. No problem.
Yeah, it will be better.
No
Thank you.
problem. No problem. No problem. So thank you very much. Yeah, I'll share my number on your. Can you share the number? My number is 0097150.
But Vipin, ideally he should discuss this with his doctor.
Okay.
My doctor is Dr. Ashok Gurplan in Bombay.
So he should discuss with him.
Okay. Okay.
You know,
No, but-
your primary doctor should know about everything about you, and he
Yeah,
will be
broad
the
picture of the.
most appropriate person to guide you.
Okay, sir. One more thing, sir. Just want to know how I can maintain the kidney health because the weather of this Dubai is a little bit hot, and I have already I completed 10 years of transplant.
So that is a very relevant question. How
Yes, sir.
to maintain the health of your kidney?
Yeah.
And
Okay,
that
sir.
is what if you you will be able to again see the whole presentation on YouTube.
Okay.
So if you follow all that I said
Yes, sir.
for normally functioning kidney, like I gave example that you should keep your blood pressure under good control. You should not unnecessarily take painkiller medicines. You should not take any unknown therapy. If you follow that, and in addition for those who are transplant cases, it is very important to take your medicines very regular.
Okay, sir. Yeah.
And monitoring is very important. Sometimes when someone has a transplant going on for as long as in your case, they tend to forget and don't monitor their kidney function. Ideally, everyone should monitor at 3 monthly intervals at your stage to make sure
Okay.
that everything is okay.
Yes, sir. Okay. So that is it. Thank you very much for your opinion, sir. Have a nice day.
Doctor, hi, this is Trisha. I had one question that for transplant, we read that generally the recipient's the kidney that is put in his body revives as early, right, after the transplant. But for the donor, the single kidney that has remained, how long does that take to actually take the complete function now that one kidney is removed?
So as I said, God has given us a lot of wisdom. So one kidney function is enough. And I also told you that every part of our body will adapt. So when you continue the same diet, this single kidney will do some extra work. So let us say your normal kidney function is 100, and now you are left with 50% kidney function. Over a period of time, this 50% will go as high as 70 or 80%.
Okay.
So even if you are left with 50% kidney mass, the function that will be after 3 months will be almost like normal, 80%.
Okay. Okay. So it will take around 3 months time.
Yeah.
For
But
actually
it can
the
be
other
it can be a continuing process.
Yes. Okay. Got it. Okay.
Yeah, doctor, one question which I had, like you explained, once the size reduce, when the end stage kidney disease is reached, the size of the kidney reduces. So does it happen that size remains, doesn't reduce too much, but the stage is end stage kidney disease?
The function.
Yeah. So in some cases, particularly in diabetic cases, the size may remain normal even when they reach end stage.
Okay.
But when the size is good and one does not have diabetes, then I would strongly recommend someone to do a biopsy to make a diagnosis.
Okay. Okay, doctor. And doctor, I had another question. Like, are there any, updates or any ongoing research which for, artificial kidneys or artificial any other way of instead of a dialysis or a transplant? Are there any researches or anything going on?
So again, my talk today was on importance of kidneys. Let us not think of losing our kidneys and artificial kidney coming with progress of science. We have to work with our own kidneys and prevent them from getting down.
Yeah.
That is the main thing. That is the message that we want to convey.
Okay.
Yes.
What to do when the kidneys fail will be another part. But
Okay.
the main purpose of the last two talks was to understand what an important function our kidneys perform and how we can protect them.
Okay. Doctor. Thank you.
Thank you.
Doctor, this is Ashok Pandit.
Yes, Mr. Pandit.
Could you please explain the importance of potassium?
So, as I said, the kidneys perform the function of maintaining normal concentration of all the chemicals. So you can understand when the kidney function goes down, obviously the ability to maintain concentration of sodium, potassium will be lost. The main source by which potassium is removed from the body is the kidney. So when the kidney function goes down, you will have a tendency for potassium to go up.
But this potassium level depends every day, or it is cumulative?
So the cumulative effect will have an effect on your potassium level. Supposing if your potassium intake, you will not understand in terms of milligrams or milliequivalents, but let us say your potassium intake is every day to the tune of 80 milliequivalents, and your kidney is excreting only 60 milliequivalents or 40 milliequivalents. Then every day there will be an accumulation of 40 milliequivalents in your body. So slowly and steadily the potassium concentration will go up. Now when the potassium concentration in the blood goes up, just because the potassium level in the blood is high, at that high level of blood, some more potassium will be lost by the kidney, but still the potassium will accumulate. Now potassium will be in the blood and potassium is also within the cells. And what is important is the ratio of potassium in the cells and in the blood. So when overall potassium in your body is high, the potassium in the blood will be high, but potassium in the cells will also be high, but your ratio may be normal. And therefore, a potassium which would be considered to be high in a normal healthy person may be well tolerated by a person with kidney disease. So if normal potassium concentration is 4, for someone with a potassium of 5.5 is high, a healthy person, but a kidney person will tolerate it well and needs no treatment.
Doctor, I could hear the ratio of?
The ratio of potassium in the cells of the body and in the blood.
Okay, yeah, thank you very much, doctor.
So let me see if in the chat box there are questions. Levels of HbA1c and blood pressure for smooth. What are the ideal sugar levels? So for a normal person, the sugar levels will remain in the range of 80 to 120. In a diabetic person, we may accept blood sugars of 120 to 150. We don't want the blood sugars to go low. Falling blood sugar causes much more problem than little high blood sugar. So 120 to 150 should be fine. HbA1c gives you an average value, but it will not tell you if there are fluctuations in your blood sugar. So supposing if there are times when your blood sugars are 250 and 300, and times when your blood sugars are 40 and 60, your average level may be normal. So a good thing to do, and what is available today, is to use continuous blood sugar monitoring devices. They come with a sensor and they will tell you every 15 minutes how your blood sugar is. So that is a better way to monitor and control your blood sugars. Any other question? Vipin bhai, any comments on today's
No,
class?
sir, it was a wonderful session, very informative. And what I will
Hello.
request you, yeah, someone is speaking.
Yeah.
Hi, good afternoon, sir. This is Arun here.
Yes.
It is
Arun.
really very, very nice information and very helpful. We are very thankful to you. Yeah, Bipin, you also
Yes.
speak something. This is really nice organized.
All the credit goes to Dr. and Narmada Kidney Foundation.
Yeah, but lead is from Mr. Bipin bhai.
Yeah.
So credit goes to Bipin bhai for
Even
pushing
I
us
feel,
and making us conduct this program.
Sir, we will conduct it every month.
Sure.
Something or other, from on blood pressure, on diabetes.
Sure.
and more emphasis on diet,
Yeah.
like
Sure.
fruit and all that also has a very important role to play. So I would like to have something about that also.
So shall we bring this meeting to an end?
Thank you very much, doctor.
Sir, this is Anand sir from Belgaum. The question is, which model do you suggest for the continuous monitoring of sugar, sir? Without the prick, you said, some sensors you said.
Yeah, there are sensors available from company called Abbott.
About okay.
Yeah.
This is like along with our body, or it is away and then we have
So
to
it's
only
a small coin-like device which you put on your arm.
Okay.
And then there is a reader along with it.
Okay.
And the reader will read the readings of your blood sugar.
Okay. These are always along with stick to our body.
Along with?
I mean, these are always stick to our body, sir.
Yeah. It's attached to the arm of your body.
Okay. And they are replaceable, like they have to be replaced after some time, because I don't know about
that
this.
sensor will last you for 14 days.
Okay.
Now, I'm not suggesting that you keep using it all your life, but once you have reached a formula that which diet, what medication gives you a uniformly good control, then you just continue that. And maybe once in 3 months, you can use a sensor to make sure that your sugars are remaining in good control. Once in 3 months or 6 months. But initially use it to find out a formula of diet, exercise, and medicine that will keep your blood sugars uniformly in control.
Okay, sir. Thank you, sir. Thanks.
So shall we bring this meeting to an end?
Okay, sir. Once again, thank you so much, sir. And everyone who had attended this session. Thank you so much.
Thank you.
Thanks to everybody. Thank you.
To everyone.
Thank you.